Derek Anderson. My presentation is over A.D.H.D, which is Attention Deficit Hyperactivity Disorder. A.D.H.D is a disorder marked by the inability to focus attention or overactive and impulsive behavior or both. A.D.H.D is a common neurobehavioral disorder most commonly diagnosed in children, although 7 is the average age of diagnosed adults can develop symptoms also. Boys are twice more likely to get A.D.H.D than girls. The history of A.D.H.D. A.D.H.D was first mentioned in 1902 by British pediatrician Sir George Steele, described an abnormal defect of normal control in children. He found that some mental retarded children could not control their behavior the way a typical child would, however, they were still intelligent. Meet David. David is a very hyperactive and inattentive 7-year-old boy. His parents noticed that he was very hyperactive at an early age. Nevertheless, they just thought he was being a kid. Then it progressively got worse. Then when school started, they noticed that he couldn't be very attentive to his homework, and also his teachers noticed it also. They continued to notice that David's behavior was getting worse and he was getting farther behind in school. David's parents had him tested by a therapist and he was diagnosed with A.D.H.D. His parents put him on Ritalin. Nevertheless, they were worried about the side effects, but they felt like Ritalin was the best thing for him. Since David has been on drug therapy, his behavior has improved significantly. Some symptoms of inattention: frequent failure to give close attention to details or making careless mistakes, frequent difficulty in sustaining attention, frequent failure to listen when spoken to directly, frequent failure to follow through on instructions and failure to finish work, difficulty organizing tasks and activities, avoidance of, dislike, or reluctance to engage in tasks that require sustained mental effort. Symptoms of hyperactivity: fidgeting with hands or feet or squirming in seat, frequent wandering from seat in classroom or similar situations, frequent running around, climbing excessively in situations which it is inappropriate, frequent difficulty playing or engaging in leisure activities quietly, frequent excessive talking, frequent difficulty awaiting turn. Causes of A.D.H.D. Scientists generally consider A.D.H.D to several interacting causes. Biological factors have been identified in many cases, particularly abnormal activity of the neurotransmitters, dopamine, and abnormalities in the frontal regions of the brain. This disorder has been linked to high levels of stress and to family dysfunctioning. Treatments: the most common applied approaches are drug therapy and behavior therapy, or a combination of the two. Ritalin is the most common drug therapy. Ritalin's quieting effect on children with A.D.H.D and its ability to help them focus, solve complex tasks, perform better at school, and control aggression. Behavior therapy is where parents and teachers learn how to award attentiveness and control in the children. This has been very helpful when combined with drug therapy. In conclusion, today scientists are trying to identify the causes of A.D.H.D as well as possible treatments. Research points to a very strong genetic link. Children with parents or siblings with the disorder are more likely to have it. Currently, it is not clear what role environment factors in determining who develops A.D.H.D. Researchers are dedicated to finding the underlying cause of the disorder so treatments can be better address the causes and find cures. Thank you.